The first step is to observe universal precautions, and in order to do that, we need to use protective eyewear and protective gloves. The next thing we'll need is some IV solution and tubing to connect to the catheter when it's in place, and you'll need a bag of fluid and the appropriate IV tubing as well. We'll use a tourniquet to wrap around the arm to help us determine which vein will be best to use. Once we've done that, we need to clean the area, and in order to do that, we're going to use first providine iodine. And once that's dried, we'll clean that off using a plain alcohol swab. We're going to have a small piece of 2x2 gauze to help clean up any messes that we might make. We need the appropriate size gel coat. We need an occlusive see-through dressing to cover the gel coat with, and some tape to secure the IV in place. First thing I'm going to do is don my glasses, so I won't forget to do so later on. I'm going to choose an appropriate site for my IV, and I'm going to put my tourniquet approximately 3 to 6 inches distal to the chosen site. And I will tie the tourniquet in the half knot so that I'm able to undo it with one hand when I'm done. While I'm waiting for the veins to appear, once I've removed the gel coat from the packaging, my first step is to pull off the protective cover, and that will show me my needle and catheter. I'm going to check to make sure that my needle is pointing with the bevel up, because anytime I put a needle into the skin, that's the way it's going to go. I also want to give a little turn of my catheter on my needle so that I know when the time comes that that will easily come apart and allow me to disconnect it and connect the IV tubing. I just put it back into the protective covering to maintain the sterility until I'm ready to insert the needle into the vein. And I can now clean the area the first time. First cleaning is with the Providine. Open the package, clean the area and a little beyond in a circular motion. Once that's dried, I can clean the area once again, this time with just a plain alcohol swab. Now that the area's been prepared, I'm ready to actually insert the IV. Slide the cap off, making sure my needles bevel up. Applying a little bit of counter-traction to the skin near the vein I've chosen. Bevel up needle, I'm going to go in right on top of the chosen vein, pushing the needle through the skin and into the vein. Once I've gotten into the vein, I can verify that by looking at the end of my gel coat and seeing what we call the flashback. Once I've found my flashback, I'm in the vein. I can now advance the catheter over the needle by simply pushing on the little tab all the way until the hub of the catheter is flush with the skin. Once I've completed that task, I can pull back on the protective covering until I hear it click. I now know that my needle's safely in my protective covering. Using one hand, I can undo my tourniquet, bring my little piece of gauze over in case I make a mess, and connect my IV tubing to the catheter. Put a little bit of pressure over the actual IV, disconnect that, and connect my tubing to my catheter and lock it in place. Dry the area. Before I cover up my tube, my IV, I want to make sure that it's working well. I'm going to do that by 2 checks. I'm going to open my IV wide open. If it's a good IV, it should be running at a good rate, and there should be no signs of swelling or redness at the site. Now, the final step is to cover the insertion site and the connection with the occlusive dressing. The site and peel off the side pieces. I can now tape the IV securely in place, making sure not to kink the tubing and pinch it off, but that I have access to that insertion port there closest to the insertion site. It's injection.